Good afternoon, everyone. I'd like to tell you this afternoon about how we've embedded personal health budgets into children's health and wellbeing services into the voluntary sector. So personal health budgets, in this instance, are funds that we allocated to the support and wellbeing of children or young people who were diagnosed or suspected to have autism and ADHD. This was driven by the fact that I think we're probably all aware that waiting times across our nation, but also in Kent, unfortunately, waiting times for assessments and diagnosis are extremely long, and in some areas, 4 years plus. And so transformation is needed, and that's been recognised throughout Kent and Medway. And this innovation, our personal health budget pilot, was set up to provide support where traditional funding streams weren't appropriate to support these families. And you can see here from the figures that per person, the budgets were actually really quite small in both our prevention and our crisis streams. It came about because we were approached by Kent Medway ICB and our colleagues at Kent County Council to be able to provide these two funding streams. The first was early intervention. So that was to provide early support to young people so that we could minimise the risk at an early stage, the risk of their needs escalating. And those referrals came from our own involved children's health and wellbeing navigators who are based within GP practices throughout Kent. The second funding stream was the other end of the scale, working with families where we were preventing crisis. This was in collaboration with Kent County Council and their dynamic support service. This was to support young people at risk of or requiring mental health support through inpatient specialist provisions. So the referrals started to come in, and we very quickly realised that to really truly provide a personal health budget, you have to take a whole person approach. Themes started to come through very quickly, that the young people were struggling with many challenges, often around social communication, social interaction, sensory issues, emotional regulation, frustration and anger. And those challenges were impacting one or many parts of their lives. Some of the themes that we saw around school attendance, family relationships, friendships, sleep, young people feeling isolated. And so Ellen, our personal health budget coordinator, created a framework from the ground up, which was specifically designed to support families to identify what mattered most to them, and then tailor solutions to meet those specific needs and their outcomes and desires. And the bottom line is personal health budgets promote choice. And I hope that this extensive list here, I won't expect you to read it all, really shows how we were able to unpick with families what specific item or service would really make a difference in that young person's life. And quite often they were really what you might think of as quite small, insignificant things. Just to give you an overview, 48% of that first funding, the early intervention, was actually spent on sensory items. So that might be things like weighted blankets, seamless clothing, sensory lighting for somebody's bedroom, or ear defenders. 26% of that funding went to help a young person to start an activity or have some sort of a sport-based outcome. But then with our crisis prevention, it was a different story. We actually used that funding in a much more bespoke way. An example of that was where we were able to fund some carer support so a young person could go to a concert that they wanted to go to. So we provided over 300 personal health budgets during that period. And you can see here from the figures that across the spectrum of wellbeing, we made improvements. We saw increase in our outcomes. In emotional wellbeing, up to 52%. But the question that was most important to us was, to what extent did your personal health budget allow you to achieve your specific outcome? And in both funding streams, we achieved 8 out of 10. And 10 really was where the outcome had been achieved completely. So I think we really had achieved what we set out to in that area. We learnt a lot as we started delivering this programme. We had to tweak as we went to make sure that we continue to personalise the health budgets that we were using, and also while we were trying to develop a service which we hadn't delivered before. And we're really fortunate that we're able now to take that learning into another year of pilot funding. We're going to be focusing specifically on those children and young people who are sitting on the waiting list for all that time, of which we know that there are thousands throughout Kent and Medway. We're also going to be able to continue to provide the crisis prevention funding. We're going to roll out the opportunity to refer into the Personal Health Budget Fund wider, to the wider community of children social prescribers who are in primary care across Kent and Medway. We're also fortunate that we're going to be able to embed this offer into the new neurodiversity support pathway, which is currently being rolled out in Maidstone, but is going to be county-wide shortly. And we've collected all of our learning and our evidence, and we've detailed that in a personal health budget paper. And that's going to be published shortly after this AGM. You'll be able to find it on our website, but we'll also be able to deliver that wider as well. So we're going to hear now from Ellen, and she's going to tell us about a couple of cases from her point of view of helping a family to ensure that those personal health budgets really did achieve the outcomes that we set out to.
When Sam first came to us, he had been diagnosed with autism, sensory processing disorder, and showed traits of ADHD. He was struggling in loud environments, and as Sam used sign language to communicate, he would often make the sign for loud and cover his ears in noisy settings. Sam was waking up multiple times throughout the night and could take around an hour to settle back to sleep again. Sam would also hug Mum tightly at bedtime to soothe himself to sleep, however this could sometimes hurt Mum's neck. Sam was seeking sensory feedback from standing on items such as books, and bright lights could cause him distress. Mum was finding it difficult to take Sam out the house because he could struggle with the environment, which limited how often Sam could go out, but also impacted his sister and his mum's well-being. Sam's Children's Health and Wellbeing Navigator identified that he needed some support with his sensory needs, so made a referral for a PHB. I then contacted Sam's mum and discussed various items which could help to address each area of need for Sam. Sam's mum had done a significant amount of research into his health conditions and the sensory items which were recommended to support him, so we were able to come up with a really comprehensive PHB package, which consisted of ear defenders, a weighted vest, weighted blanket, sensory playmat, a blackout sensory den, and a small selection of sensory lighting, which were all purchased and delivered to Sam's house. I got in touch with Mum around a month after the items were delivered to see how Sam was getting on with them, and I was so pleased to hear that things had been working really well for him. Mum shared that all the items had been excellent. The ear defenders were allowing Sam to go out in crowded places and enjoy himself, which would have been extremely difficult before. I was thrilled to hear that Mum had taken Sam and his sister to the Christmas lights turn on in their local town, and despite this being the sort of situation which Sam would have really struggled with in the past, he asked for his ear defenders and he was happy. Not only was this the first time the family had been into town in over a year, but Mum described it as the best experience they had ever had when going out the house. Mum shared that Sam was loving the sensory playmat and used it exactly as she predicted, lining it up so he could walk along it like a path and licking it for the sensory feedback. Mum said she tended to leave the items in a trolley and he would always go to get the playmat straight away. Mum felt it had almost become a part of him and his everyday play. Sam was also loving the blackout den and would take great amusement from going inside it, and Mum felt it was providing a safe space for him. Interestingly, Mum shared that he'd started to tell her that there was a spider in his bed, which he was scared of. However, this was the first time Mum had seen him use his imagination, so she was really pleased to see his progress and wondered if the new items had helped to spark his imagination. She could also use the sensory lights, particularly the dinosaur ones, to help scare off the imagined spider. Overall, Mum had seen a real improvement in Sam's behaviours and said that the different groups and professionals that they had met with had also commented on his progress, saying that eye contact had improved and that he was playing much more nicely. He had also started to engage more with his sister, something which was new for him, and Mum felt that the sensory items had a big impact on this. Overall, the PHB was a real success, and I'm so pleased that just a few items were able to have such a profound impact on this young person's life.